Joining me now is my colleague, editor of ForbesWomen, Maggie McGrath. Maggie, thanks for coming on in.
Thanks for having me.
The legality of an abortion pill is now in question after a federal judge in Texas blocked its FDA approval nationwide. Before we get into the legality behind all of this, I do want you to give us some background on mifepristone, the abortion pill in question.
Mifepristone is one of two drugs that are taken in a medication abortion. To be very, very clear, medication abortions account for more than 50% of abortions in this country. They are deemed very safe by the medical community. Mifepristone is a pill that was approved by the Food and Drug Administration in September of 2000. It went through 4 years of approvals by the scientific community, by the medical community. Doctors and OBGYNs say that 99.9% of patients use it without any adverse effect. It is safe, it is effective. It basically blocks a hormone that is needed to continue pregnancies. So you take mifepristone, you wait 24 to 48 hours, and then you take misoprostol, which expels the pregnancy. So that's how it works on the medical side.
From what you're saying, it sounds like it's very safe, and according to data analyzed by CNN, the drug is apparently safer than both penicillin and Viagra. So knowing all of those facts that you and I just said, why was this drug blocked?
How much time do you have? Judge Matthew Kacsmaryk in Texas is a federal judge who has a notable and long anti-abortion history. He is a conservative judge. He was appointed by President Trump. This is a political decision. It is one that he cites as being grounded in science, but that is misinformation, disinformation. He says it didn't go through the appropriate approval processes. He says that it's not safe for women. You will see a lot of this paternalistic language in a lot of these anti-abortion decisions and rulings. You know, it's for the safety of women. But the scientific community disagrees. So he put a stay on the FDA's approval of mifepristone, and he then put a 1-week stay on his stay, if you will. So basically, he gave the legal community and the Biden administration a week to challenge the opinion, and then, which they did. The Justice Department challenged it. But after a week, depending on, we're kind of in the middle of all of this right now. And what his ultimate goal is to render the approval null. So then doctors cannot prescribe mifepristone to their patients.
Maggie, I do now want to move on because in Washington state, the exact same night, there was a conflicting ruling. Federal Judge Thomas Rice there prevented the FDA from, quote, altering the status quo and rights as it relates to the availability of mifepristone. So as we sit here, is mifepristone in jeopardy? Is it safe? What do we know?
It's chaotic, is what we know. What the Washington judge ruled applies to 17 states where abortion is legal. What the Texas judge ruled applies nationwide. So we have these two conflicting rulings, and the upshot is I don't know anyone who doesn't expect this to go to the Supreme Court. You say, is mifepristone legal? Right now it is. Right now, if you have gone to plancpills.org and have put them in your medicine cabinet, if you need them right now, you can still access them if you live in a state that permits abortion. So that's the big asterisk. Obviously, we live in a country with a patchwork of abortion laws right now in the aftermath of Roe v. Wade being overturned. But right now, you can get it. And if the Texas judge's stay goes through, if he basically revokes the FDA's approval of mifepristone, he has limited doctors' ability to prescribe it. He does not limit your ability to take it. So if you procure it and the stay goes in place and you have it, check with the legal ramifications within your state, but it doesn't affect the legality of taking it. And none of this affects what medical and scientific experts have said about the efficacy and safety of this drug.
Speaking of that medical community, what has their response been?
What's really interesting is this all sounds like a political issue, but there are real business ramifications for the business community that reads Forbes, for the entrepreneurial community that reads Forbes. Some 400 biotech and pharmaceutical executives signed a letter denouncing the Texas rule. And I want to read part of that letter because I think it's important. They basically see ramifications for other drugs here. Their argument is that this judicial activism won't stop here. That's a direct quote. They say, if courts can overturn drug approvals without regard for science or evidence, or for the complexity required to fully vet the safety and efficacy of new drugs, any medicine is at risk for the same outcomes as mifepristone. While the drug development, approval, and monitoring process is not perfect, the agency's framework has resulted in decades of unsurpassed medical innovation and in mechanisms to remove drugs from the market if there are reasons to remove it from the market. So that is a very strongly worded statement from executives from Pfizer and other companies that and the biggest names in biotech and pharma. They're basically saying, what happens to drugs that are in development for Alzheimer's? What happens to vaccines that are in development and need to be used? This is an attack on the abortion pill, but the ramifications are far more widespread than just reproductive health.